Today, I want to talk to you about the signs of chronic kidney disease in cats. Here's why it matters. Kidney disease is one of the top 3 killers of cats. By the time a cat reaches their senior years, a huge percentage of them are living with some degree of it, and most owners have no idea. The kidneys are what we call a silent organ. They filter waste, balance water, control blood pressure, even help make blood, and they keep doing it without complaint right up until they can't. By the time obvious symptoms show, a large part of the kidney is often already gone, and that damage can't be undone. So the single most powerful thing you can do is catch the signs early. That's it. Catch this early and you buy your cat more good years. In this video, I'll walk you through 20 signs, starting with the subtle ones and building to the ones that mean act now. Watch to the end, because the later ones are the ones people miss most. Let's get into it. Number 20. Peeing more than usual. Healthy kidneys pull water back into the body so it isn't wasted. When they start to fail, they lose that ability, and the water leaves as urine instead. So a heavier, wetter litter box than you remember, bigger clumps, more of them, is one of the very first quiet signals, and it usually shows up before anything you'd think to worry about. Number 19. Drinking a lot more water. This goes hand in hand with the last one. Losing extra water through urine leaves them thirsty. Cats are naturally terrible drinkers. Most get their water from food and barely touch the bowl. A rough rule of thumb is about 50 milliliters per kilo of body weight a day, food included. So a 4-kilo cat needs roughly a cup. But don't get lost in numbers. The real signal is change. If yours is suddenly camped out at the bowl, the tap, or your water glass when they never used to be, that matters. Number 18. Eating less. Maybe they sniff the bowl and walk away. Maybe they're just picking. This is easy to miss if you free feed, since the food disappears and you assume they ate it. Set meals help you actually notice. And keep this in mind. Sometimes it's not the stomach, it's the mouth. Sore teeth make eating genuinely painful. We'll come back to that connection. Number 17. Weight loss. This one's sneaky because it happens slowly, and you see your cat every day, so it hides in plain sight. A good benchmark is 10%. A healthy 10-pound cat quietly dropping to 9 is significant, even if they seem fine. If they feel lighter when you pick them up, or their spine and hips feel sharper than they used to, don't write it off as aging. Quiet weight loss is one of the clearest signs something's wrong underneath. Number 16. Vomiting more often. Cats vomit, hairballs happen, so one bad morning isn't a crisis. A pattern is. More frequent vomiting, or bringing up food long after they've eaten, is your cue to pay attention. As the kidneys fall behind, toxins build up in the blood and can trigger nausea directly. It's the change in rhythm that tells the story, not any single episode. Number 15. Loose stools or diarrhea. As the kidneys tire, the whole digestive system gets unsettled along with them. On its own, it's minor, but showing up alongside the drinking, the appetite changes, the vomiting, that's when the small pieces form a picture worth taking to your vet. Number 14. On the flip side, constipation. Losing all that water leaves a cat dehydrated, and a dehydrated body claws back moisture from everything it can, including whatever's moving through the gut. The stool turns hard and dry and simply stops moving well. So straining in the box, or skipping a day or two, can trace right back to that same water loss. Different symptom, same root cause. Number 13. Dental trouble. I promised we'd come back here. The mouth and the kidneys are far more connected than you'd think. When one struggles, the other tends to follow, each one feeding the other. So suddenly stronger bad breath, red or bleeding gums, or your cat pawing at their face and chewing oddly aren't just cat breath. A healthy mouth is one of your clearest everyday windows into how the rest of them is doing. Number 12. Urine that smells stronger or looks cloudy. This one usually points to an infection in the urinary system rather than the kidneys directly, but it's the same neighborhood and the two often travel together. A box that smells much sharper or urine that looks murky or discolored is worth flagging rather than shrugging at. Number 11. A dull, scruffy coat. A healthy cat is a fastidious groomer. That sleek coat takes constant work. When they don't feel well, grooming is one of the first things to slide. A coat that's gone rough, greasy, or clumpy when it used to be beautiful isn't laziness. It's often a sign the body is spending its energy elsewhere. Number 10. Accidents outside the litter box. When a normally tidy cat starts going in the wrong places, hear it as communication, not defiance. Something in their urinary world feels off. Rule out the simple stuff first. A cleaner box, an extra one, a bigger one, a different litter, maybe a quieter spot. But if you've genuinely covered the basics and it keeps happening, that's a sign worth taking seriously instead of scolding. Number 9. Fever, or just seeming warm and unwell. Cats get urinary infections less often than dogs, but when they do, it can bring a fever along with it. If your cat seems hot to the touch, hunched, withdrawn, and plain off, trust that instinct. You know your cat's normal better than anyone on earth. Number 8. Dehydration you can actually feel. Gently pinch the loose skin at the back of the neck, then let go. On a well-hydrated cat, it snaps right back. If it takes 2 or 3 seconds, or tense up and lingers, they're low on fluids, and the slower it is, the more serious. It's the same quick test vets use, and you can slip it into an ordinary cuddle. Number 7. That feeling that something's just different. I trust this one as much as any test, because you're the one living with your cat, sleeping more, not jumping to their favorite high perch anymore, seeking out cold, hard floors, not coming when you call. A cat who always hated being held suddenly wanting to be held. Any one of these is easy to file under just getting old, but sometimes that quiet shift is the earliest sign there is, and it's worth listening to. From here on, these are the ones that mean move, not panic, but move. Number 6. Seizures, or abnormal trembling and twitching. When the kidneys can no longer clear toxins, those toxins build up and start affecting the brain. There are other possible causes, but honestly, it doesn't matter which in the moment. A seizure is always a get-to-the-vet-now situation. No waiting. Number 5. Straining with little or no urine coming out. A cat going to the box again and again and producing almost nothing is a true emergency, full stop. And it's especially dangerous in male cats. When urine can't leave the body, everything backs up fast, and this turns life-threatening within hours, not days. Don't wait until morning. This is a right-now trip. Number 4. Pale gums. Here's something most people don't know. The kidneys help signal the body to make red blood cells. So when they struggle, a cat can slowly become anemic. Lift the lip and check the gums, or the tongue. Healthy is a nice bubblegum pink. Pale, washed out, or nearly white is the body's low-fuel warning light, and it deserves prompt attention. Number 3. Wobbliness. By this stage, a few things are stacking up at once. Anemia, shifts in blood pressure, toxins affecting the nerves. It shows up as a cat who seems almost drunk on their feet, swaying, stumbling, struggling to walk a straight line. A normally graceful cat gone wobbly is a meaningful sign, not simple clumsiness. Number 2. Harder or faster breathing. As things progress, this can come from nausea, strain on the heart, or rising blood pressure. Tonight, while your cat is resting, watch their side rise and fall and count the breaths in a minute to learn they're normal. Most relaxed cats sit in the 20s or low 30s. Once you know your cat's number, you'll instantly notice the day it climbs. And number 1. Red eyes, or bumping into things. I saved this for the top because it blindsides so many loving owners. As kidney disease advances, blood pressure can climb dangerously, and the delicate back of the eye is extremely sensitive to it. So a cat can actually lose their sight. At first, it looks like clumsiness, bumping into furniture, misjudging jumps, hesitating in familiar rooms. It gets written off as old age or fading eyesight. But visible redness in the eyes, or a cat suddenly navigating like the furniture moved overnight, is urgent. Caught fast enough, there's sometimes a real window to protect what vision is left. So there they are, 20 signs, from the tiny whispers to the loud alarms. You don't have to memorize every one, you just have to know your cat, their normal weight, their normal habits, their normal rhythms, so that when something drifts off course, you feel it early. That's the whole game. The earlier you notice, the more your vet can do, and the more time the two of you get to share. If this helped, stick around. I break down the mysterious little creatures we're lucky to live with, one video at a time. Give your cat a scratch behind the ears from me, and I'll see you in the next one.